Welcome to the Plant-Based Asia Summit, where we inspire a more sustainable and healthier Asia Pacific. My name is Luke, your co-host, and today I have the privilege of introducing you to Dr. Jia Xu. Dr. Xu received his bachelor's degree in biophysics at Peking University and his doctorate in physiology at the Johns Hopkins University School of Medicine. Since 2010, he has served as a nutrition specialist at the Physicians Committee, playing a role in clinical research efforts and helping to launch a Mandarin version of the 21-day vegan kickstart. Welcome, Dr. Xu, and thank you for being on the summit today.
It's my pleasure to be here. Thank you, Luke, for invitation. Thank you so much. Welcome to the Plant-Based Asian Pacific Summit. My name is Dr. Jia Xu, and the topic of my talk today is nutrition as the first-line defense for COVID-19. I'm the author of a best-selling book in the mainland China called 非药而愈, Healing Without Medicine. So actually, let's begin from this data set from the China CDC published on February 2020. It is the relationship between underlying conditions and COVID mortality. And so basically what they found in the beginning of the pandemic was that if you are hospitalized because of COVID-19 and have an underlying condition, such as cardiovascular disease, diabetes, etc., your mortality of dying from coronavirus will be much, much higher compared to those who has no pre-existing conditions. And the difference could be as far as like tenfold difference in terms of mortality. That's why if you have an underlying conditions already, such as those what we call the modern or chronic diseases, you should start to think about changing, because these diseases are what we call lifestyle diseases because of wrong lifestyle, such as bad eating habits and bad health habits. Because of these it's your because of these situations of your self choice that cause these conditions, and which actually undermine your health reserves for future future incoming, for example, attacks from the nature, such as the COVID-19. Most of these COVID-19 patients die from a situation called acute respiratory distress syndrome, or we call ARS. So let me explain this because it's important to understand why people die and then what's the reason for the dying. And our respiratory system looks like an inverted tree, and the alveoli, where the air exchange occurs, is like the leaves of the tree. The alveoli, actually, in this case of the alveoli, there's a dead end air sac, which is actually in very close approximation of our capillary tubes. And then in the capillary, and you have a higher concentration of CO2 and lower concentration of oxygen. And in the air sac, you have the opposite. So because the approximation is so close, it allows the air to freely diffuse across its concentration gradient, so that the CO2 will flow into the air sac, and oxygen will flow from the air sac into our capillary. And then when it comes out, you have a refreshed, oxygenized blood. And in the case of the acute respiratory distress syndrome, which happened in the severe COVID patients, first you have a inflammation, and the inflammation comes from the dead cells that resulted from the virus infection of your immune attack of your own lung tissue in response to this infection. And the inflammation causes a hyperemia, or a swelling of the tissue, and eventually cause exudation or oozing out of the liquids, such as um, mucus into the interstitial space between the air sac and the capillary tubes, and also into the air sac itself. And these and these liquid actually prevent a normal exchange of air between your air sac and the capillary tubes, so that the patient could, at this situation, breathe very hard, but but its oxygen pressure in his blood is remains very low, and so the patient usually die from a condition called a respiratory failure. So in which you don't have you don't have adequate exchange of oxygen into your blood. And so because of all these liquid in your lung, actually on your X-ray, you will see a condition looks like a ground glass opacities. Basically, all these wide area of the lung represents liquid in the blood resulted from the inflammation process. So the key here is inflammation, because if there's no inflammation, there will be no hyperemia or exudation, or at the end the respiratory failure. So inflammation here is the key. Why the people with underlying conditions have more inflammation? It's because they already have underlying inflammation. And that this underlying inflammation plus is superimposed by this COVID-19 induced inflammation. And then you reach a situation where you have an inflammatory storm or cytokine storm. And the cytokine storm becomes uncontrollable. And then you have this kind of self-tissue damage. And then after that, you have a series of these events occurring in your lung and resulting in acute respiratory distress syndrome. So the underlying inflammation already exists in these people who have pre-existing conditions. And in the case of healthy individuals, they don't have, or they have a weaker, much weaker underlying inflammation. So where does this underlying information, why does this underlying information happen? It's mostly because there are many aspects that could contribute to this underlying inflammation. But one very important one, which I'm going to talk about today, is the leaky gut. The leaky gut is basically a damage of the intestinal barrier of our gut, of our digestive tract, and so that there's a, how can I say, the normal barrier function of the gut disappears, and then whatever uh, the substance that's not normally able to enter your bloodstream now is able to enter your bloodstream and causing systematic inflammation. So it is like this. So we are in our gut. We have two type of bacteria: the beneficial bacteria and the harmful bacteria. And today I'm going to talk about one type of harmful bacteria called uh, Bilophila westwardere. So this type of bacteria responds to bile. So basically, if our digestive system have more bile, it will thrive. And why is bile excreted into the digestive system? It's because we take in a lot of fat, especially saturated fat. And so when we eat a lot of saturated fat, our gallbladder will excrete, more bile, and especially those saturated fat from the animal origin, causing us to excrete a type of bile called taurine conjugated bile. Uh, so this taurine conjugated bile basically will release taurine. So taurine is actually an amino acid that only exists in animal protein. So when you eat, food with animal protein that is also characterized with saturated fat, it will also release taurine. And the bile will basically, will stimulate the growth of this particular bacteria, Bilophila westwardere. And then this bacteria will basically work on act on this taurine and release an end product, hydrogen sulfide. And hydrogen sulfide actually, when it occurs in our intestine, it causes intestinal inflammation and it causes a damage to the barrier of our, the damage to the intestinal barrier, which is a one single layer of enterocytes. And then this damage eventually causes a leak in between the enterocytes of the, how can I say, the intestinal cells. And then basically this leak in between and this passage between these normal cells will cause this situation called leaky gut, where those substances normally won't allow now penetrate this gut barrier and into our blood, and this is called leaky gut. And this leaky gut will cause a situation a situation where the bacteria, some bacteria toxins such as endotoxin will cross over into our blood, and endotoxin has a will cause inflammation. And endotoxin will also will be carried with our circulation into the other part of our body and causing inflammation, causing a systematic inflammation. And this systematic inflammation will basically increase the risk of cardiovascular disease, type 2 diabetes, non-alcoholic fatty liver disease, uh, obesity and hypertension, etc., etc. All these are called, the underlying disease conditions. And also in the leaky gut condition, there's another situation where the food allergen will cross over into our blood, and then our immune system will attack these allergens. And if we eat the same type of food over and over again under a leaky gut condition, then we'll have a food allergy. And so nowadays a lot of people have food allergies. So that's mostly because nowadays we have a lot of leaky gut, people with leaky gut. And then autoimmunity, such as a lot of the problems, etc. Actually, is a special type of food allergy where some foreign antigens cross over into our bloodstream through leaky gut and then causing immune attack. But in this case, the allergen is the foreign antigen is very close information in it's very close in morphology to our own antigen, and then this cause a possibility of cross reaction by our immune system. So our immune system in this case will attack our own tissue. So that's why it's called autoimmunity. So all these conditions are characterized by inflammation and it's the result of leaky gut. So we call them leaky gut syndrome. And so it's also actually the underlying conditions where, in the first slides we referred to. So in order to prevent or even to reverse this leaky gut syndrome, the key is to prevent and reverse leaky gut. And to prevent and reverse leaky gut, we should not grow the harmful bacteria in our gut. And eventually, we should not eat a lot of food with saturated fat and animal proteins. So in this chart on the left is our food, on our right is our disease and syndromes. And basically there's a causal chain in between these two. So because of this, because of this causal chain, we should really, restrain ourselves from eating food that can cause this leaky gut syndrome. So that's why our diet matters in terms of, whether you have systematic inflammation or not, or underlying disease or not. So there's a lot of theories and other experiments that has been done, but we don't have a lot of time to explain about that. But let's talk about what happens when we eat one single meal of saturated fat and how it relates to endotoxin and systematic inflammation. And so in this experiment, what happens is, the people are fed a high saturated fat diet, and then they are followed for 4 hours after this diet, and endotoxin levels were measured. And in the case of the normal or healthy individual, you can see a doubling of endotoxin after 4 hours after this, high saturated fat meal. But in the case of type 2 diabetes, you have a increase from 5 to almost 15, so a tripling of the endotoxin levels. So if you already have underlying conditions such as diabetes, you should be even more careful about what you eat. But in the reality, a lot of people don't know, and usually it's those who are unhealthy eat the most unhealthy foods. And this is another experiment where they measured endothelial function, which is also a function of the inflammation response of our blood vessel. So here they measure the flow-mediated vessel activity. Basically, it is the how it's basically if the activity is strong, means your blood vessel is very healthy. You have a good function and you have less inflammation. But if the activity decreases, it means you have a increased inflammation. So here, what they did is they fed the volunteer with egg plus sausage meal, and then follow their endothelial function for 6 hours. So you can see within 4 hours, the volunteers' endothelial function dropped by about 50%, and this is a significant drop, reduction of the endothelial function, or significant increase of the inflammatory response of our blood vessels. So at 5 and 6 hours, you can see a returning of the endothelial function, although not completely. But unfortunately, at hour 6, our next meal will come. So if actually you eat the same type of meal every time, and then basically your blood vessel will be under inflammatory stress all the time, and you have a very much impaired endothelial function, and then you have a continued chronic inflammation of your system. So there's another experiment. They gave 10 young men three type of meals, uh, and see their endothelial function. You can see the orange means before and the red means after, 4 hours after the meal. So if you feed them a low-fat meal, such as those with a vegetarian or vegan diet, especially with a low-fat, no added oil diet, then you have a very healthy endothelial function, after the meal. But if you feed them McDonald's, then you have basically you beat up the endothelial function from heaven to hell. But if you feed them a so-called a healthy high-fat meal with local, a so-called a local high-fat, for example, in the Southeast Asian, we eat, coconut oil. There's a lot of advertisements saying that it's healthy, and some fish and some eggs. And in fact, this is what they did in this third situation. You'll see the same type of response as that uh, of the McDonald's meal. So a high-fat diet, regardless of whether they're fried food or westernized or the local, uh, Asian, high-fat meal, it's the same. It causes the same type of damage for our blood vessels and endothelial function. And those are individual studies. And here we have a systematic review of 47 studies, uh, you know, you know, testing the postcranial inflammatory response. You can see the IL-6 is a inflammation marker, basically doubled, after the meal. So a single meal basically will be enough to increase the inflammation of your system by twofold. So this is very significant. So on the other hand, if you eat the right meal, the healthy meal, which is filled with fiber and low fat, then it will stimulate your beneficial bacteria, which actually generate a series of short-chain fatty acids, such as acetic acid, propionic acid, and butyric acid. And these short-chain fatty acids have anti-inflammatory and anti-obese activities, and also increase your cholesterol synthesis and and inhibit intestinal tumor. So these are very, very healthy, uh, healthy opposite situations if you eat the right diet. So what you eat, that's actually the true. That's actually true. So let's see this another experiment in which they have 360 patients undergoing a hematopoietic stem cell transplantation. So what happens is they will ingest they will inject stem cells into their bloodstream to replace their original damaged stem cell systems. Usually these people are basically they are they what was it called? They were treated with radiation to remove their own blood hematopoietic cell system. So that's why they did already defenseless at the time of transplantation. So a key feature, a key marker, success marker of this surgery, of this process or of this protocol, is the respiratory tract infection percentage. So if you have a low percentage of infection, that means you have a successful surgery. So in this case, they had 149 infections and 46 total respiratory tract infections, especially with with the virus. And what they did is they collect the fecal samples of those patients at the time of the transplantation to measure their bacteria, the bacteria in the fecal samples, which produce butyric acid, which basically means those those people who have a high percentage of butyric producers would have, would represent the case that they have a much healthier diet. But those with low butyric acid means that usually they're probably eating McDonald's every day. So the result shows that those with high butyric acid producers, their lower respiratory tract infection reduced by 80% after 6 months of follow-up. So this is very significant. That means if you have a right diet, you anti-inflammatory diet, basically you actually will reduce your chance of catching this viral infection by 80%, and which actually is also very useful, which could be which could be related to to COVID-19 infection, because it's also a respiratory tract infection, a viral infection. So this is really this work published in 2018 really give us a very good hope of those people with healthy diet will have a less infection. So we know the people with healthy diet, especially those with low-fat plant-based diet, will have a low inflammation in our gut, and which actually eventually will have a lower inflammation, index in our blood. So this is actually was the case, based on this 29 study meta-analysis. You can see, there are three of these markers: CRP, C-reactive protein, IL-6, and ICAM. Uh, all three of them actually have a decrease, after a plant-based diet intervention. So overall, a plant-based diet will actually reduce inflammatory markers in almost all these 29 studies. This is confirmed by another meta-analysis of 30 of the observational studies and 30 at 10 randomized control trials, uh, in which case they find reduced CRP, inflammatory marker, for those people who are following a vegetarian diet. At the same time, this is correlated with a reduced white blood cell count. Reduced white blood cell count is very, for a lot of the people, they are puzzled why vegetarian people or vegan people have a lower white cell count, and they sometimes uh, interpreted this result as those vegan people or vegans or vegetarians will have a lower immunity, or they have a lower immune capability. So this is usually this is a misunderstanding. So what happens is really here, if in the vegans you have a low inflammation, systematic inflammation, and then because this inflammation is low, then you have a low need for a lot of white blood cells. So it's like a society is peaceful, and then you don't need a lot of army or police officers to maintain it. So actually, a low white blood cell count is a good indication. It's a good sign of a healthy individual. So actually, this is represented in this other experiment. I think this is a U.S. experiment with 160,000 people and 16-year follow-up. As you can see, as you go up into the white blood cell count, you actually have an increased mortality, total mortality, and increase cardiovascular mortality, and also increase cancer mortality. So it's not always good to have a high white cell count. A low white cell count with no unhealthy conditions actually is the best. So some people would argue that if you have a low white blood cell count, how would you face the potential infection in the natural world? So maybe that's a negative part of being a vegetarian. So I think this German study will tell you will give the answers. So what happens is that they ask some healthy vegetarian males, and they match those vegetarian males with omnivores. And what they did is they drew their blood and then test the white cell, in particular the NK cell cytotoxicity. And this test basically tests the killing power of each unit of these white blood cells. And then the result shows that those vegetarian people's blood will have 2x higher NK cell cytotoxicity. And actually, it's not because they have two times more NK cells, but rather they have each NK cell from a vegetarian have a 2 times more toxicity or killing power. So, so the result of this experiment, together with previous experiments, shows us that a vegetarian or vegan diet actually gives us the best of both worlds. You have a low inflammatory situation, so you have a low white blood cell count. On the other hand, if you're actually facing an intruder, your white blood cells actually will display a higher killing power, like special forces, well trained, and so you're well protected. So this is another experiment published in 2014, and it's a summary of what the Loma Linda experiment universities have done. What they did was to divide the population into 5 different groups: vegans, vegetarians, pescatarians, meaning those who eat only fish and maybe eggs and but no meat, and then semi-vegetarians meaning they don't eat red meat, and non-vegetarians means they eat everything. So and then they see the risk for diabetes, obesity or overweight, and cancer and high blood pressure. And you can see as you go across the spectrum of these different dietary patterns from a more plant-based into a more animal-based diet, and then your diabetes, your cancer, your obesity and high blood pressure risk all increases. So basically that means if you have a healthy dietary structure like a plant-based diet, you'll actually reduce your chance of having a underlying conditions, which definitely again will reduce your COVID-19 infection severity, severe cases of COVID-19 if you're infected. So so all these experiments shows the benefit of being a vegetarian and vegan in under the current current situation where you have a worldwide pandemic. So some people will ask, will ask, is a plant-based diet nutritionally adequate? There's a lot of studies and a lot of studies, but we don't have time to cover all of that. But here is a position paper of the Academy of Nutrition and Dietetics of the United States regarding the vegetarian diet. Let's read the positions, the abstract here. It is the position of the Academy of Nutrition and Dietetics that appropriately planned vegetarian, including vegan diets, are healthful, nutritionally adequate, and may provide health benefits for prevention and treatment of certain diseases. So I think that summarizes everything. So if you eat it right, the plant-based diet is a powerful tool to protect us from not only a underlying conditions but also future infections. By this potential uh, tr- infectious disease. So how to well plan your vegetarian diet? Here are what we think are the key elements of healthy diet. What we call a low-fat, whole food plant-based diet. So, and the power plate on the right is actually is a Physics Committee's invention in 2009, and it actually have carried through into 2011's United States uh, you know uh, dietary guideline, and where they basically they just replace the legumes into proteins. So it is very so basically it's a almost a complete adoption of our power plates. So what we emphasize is not eating something. So a lot of people tend to think that we have this disease or that disease because we miss some type of nutrients. So we want to add something into our diet. We want to not missing something in our diet. But I think in the case of what we think is that the key is not eating something. It's because we eat something wrong, or we eat something too much that cause the current unhealthy conditions. And this is mostly the case for the foreign for the current current situation of all the underlying diseases. So the first thing we do is to eat plant, not animals. The second thing is eat whole but not processed foods. So I think these are we have already talked a lot about them. And the third thing is low fat with no added oil. If you eat nuts or the oil containing seeds, then you eat altogether. This should be less than 1 palmful every day. Low fat. This is consistent with our leaky gut theory. And the fourth thing is eat enough calories. This is very important, and this is the reason why some of the vegetarians or vegans failed, in their in failed because they didn't eat a lot. Some people don't eat enough calories because now you don't eat animals and you have low fat, and all your calories shoot from the grains and the legumes that you eat. But a lot of people don't eat grains and they think grains are unhealthy, and it causes you a situation where you have under calorie. If you don't have enough calorie supply, then you burn your own fat and your own tissues. Eventually, you'll be you have a situation of wasting, or in terms of women, they may lose they may have a how can I what's called the menarche no what it called menopause, basically a false menopause when it shouldn't happen. So basically because of your low calorie intake. So you should eat enough calories and enough grains. Eat starches, and those are your main calorie sources. And the fifth thing, you should supplement. You should supplement yourself with daily vitamin B12, and this is because the vitamin B12 come from bacteria, and the modern way of producing food have already isolated us from bacteria. So our food have less vitamin B12, and also we live in a almost sanitary environment where we kill almost all bacteria with soaps and detergents. So that's why we're missing the modern lifestyle and also the culture, the agriculture condition, doesn't allow enough vitamin B12. That's why we need to supplement that with. But those people who eat meat, they don't need vitamin B12 because the vitamin B12 is already supplemented in the in the in the how can I say, in the feeds of animals. So those animals will eat a fortified vitamin B12 fortified feeds. So their meat and their eggs and dairy will have some amount of vitamin B12, so they don't need it. And then we ask vegan people to have about 10 to 10 to 15 grams of flaxseed to supplement some omega-3 into their daily diet, and then enough sunshine to produce vitamin D. So if you have done all these 5 points, then you're do excellent in your healthy diet. But that's not overall health. Overall health is diet plus sleep, exercise, sunshine, and mental health. This is what the Chinese call the Jing, Qi, and Shen. Basically, it corresponds to material. This is energy, and this is information. Information. So we need to have a overall health, you need to have all of these. So that means, but of course, if you have a vegan diet, you already greatly reduce the risk of many diseases. But you still have you are still possible to catch on some kind of diseases, if the other aspect of health is not completely done. Okay, so this is what I have to talk about today, and thank you so much for your attention.
Thank you very much, Dr. Tiashi. That was very, very thorough, and I love how you, at the end of it, just simplified it into material, energy, and information, and how really a plant-based diet, to a certain degree, is a natural vaccine in many ways in boosting our health and immune system. So, what I just want to kind of pick up on, where sunshine is concerned, I understand that vitamin D is correlated to boosting the immune system as well. So maybe you can share a little bit on vitamin D, on supplementing with vitamin D, and how it can actually help boost the immune system for people who maybe lack it.
The reason vitamin D is important is that because it is actually not a vitamin. It is a, a how can I say, a hormone, in some sense. Yeah. So actually, it acts as a hormone. So the vitamin D you take in is not the active form. It needs to be activated twice in your liver and then in your kidney to become the active form. So it's actually very tightly controlled. If your active form of vitamin D is too much, then you have a problem. And if you have too low, it's have a problem too. So it's a hormone. Why is such a vitamin? Why is vitamin D a hormone and it is related to the immune system? It is because vitamin B is a very ancient response system of our body to light, and this light response actually will be, how can I say, will be translated into a, how can I say, is into reproduction into a reproduction signal. So when in the summer you have a long exposure to sunshine, then you have more vitamin D, and in the winter you have low percent vitamin D. So vitamin D here helps to increase the immune tolerance, and so reduce the non-specific immune rejection, and that's actually That's why vitamin D is important in reduce inflammation in our body too. So in the case of COVID, you have inflammation. So a high vitamin D level will help to reduce your all these to increase your immune tolerance. In other words, so So increased immune tolerance means less immune attack and less inflammation. And so that will help to reduce the severity of a COVID-19 infection.
Okay. So with that in mind, should people consider supplementing vitamin D at all?
It depends on your vitamin D level. I would encourage you to do a vitamin D test. If your vitamin D is in the normal range, you probably don't need a supplementation. But if you are not, then I would strongly suggest that you do so. And especially for those people who follow a low-fat vegan diet, because the fat intake is low and vitamin D is a fat-soluble vitamin, so you should take higher amount than normal to supplement. So in which case I suggest that you take about 2,000 to 5,000 international unit of vitamin D per day if you are not having enough sunshine.
Fantastic, Dr. Jashu. Thank you very, very much for all that you shared today. It was a very, very in-depth presentation that really came out with, that really was summarized with a very simple solution, get sunshine, eat a plant-based diet, and have good thoughts.
Yeah, good thoughts and exercise and good sleep.
Indeed. Thank you, Dr. Jashu.
Thank you, Luke.